when you encounter those recalcitrant patients who you've done they're doing everything right at home, right? They're doing the exfoliative cleanser, they're doing the toner, they're doing the topical antibiotic, they're doing the tretinoin, they've taken the 3 months of oral antibiotic, they come back to your office, they swear by it up and down, they did everything, and they still have acne.
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the MedSpa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate Dee. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate Dee, and I am back today with Dr. Christopher Rex. He's been on the podcast before a couple weeks ago. If you missed it, we talked all about hair loss in episode number 5 of this season. And he's on today to talk about acne because we got to that topic last time and we had so much exciting stuff we wanted to talk about. So thanks so much for being back here.
Dr. D, I'm really glad to be back with you. It was fun last time, and I believe it's going to be fun this time. Good topics.
Well, so last time we kind of got on a riff about acne, and I guess we're both very passionate about it. And we had talked about kind of the basics, and I had kind of complained that it seemed like a lot of people came to me and they hadn't been offered the basic recommendations for skincare for acne before all the medical stuff started. So, and you're like, oh yeah, that's conservative management. So I was hoping we could start with that and then proceed with the other treatments that we have for acne. Because I feel like between the two of us, we could probably cure like the vast majority of all the cases of acne across the country.
That's a lot of acne.
I know it's a lot of acne, but it's like, don't you feel like, you want to help these people because it's like totally doable?
I agree with you. And it's always an interesting journey when it comes to acne, right? Because when it comes to acne, you really want the person who comes in to see you to be really passionate about treating their acne. Many times with dermatologists, the person coming in is the parent bringing a kid who could care less. So now you're kind of dealing with a kid who doesn't want to do anything for their acne, and you're recommending all these things that the parent sees it, they want it done, and many times I have to sit them down and say, hey, if he or she is not going to do the treatment, the acne is not going to go away because I prescribe it.
Yeah.
So I think the first thing to cover is if you want your acne gone, you have to be willing and able to apply and comply with the different recommendations.
Totally agree. And honestly, what I tend to see is a lot more adult onset acne and people who are totally frustrated with it. Nothing's really worked. And they're coming to see me if there's anything that I can do before they end up undergoing Accutane treatment. And I feel like of those people, so many of them have never, ever even been given a really good skincare regimen. So we always start with that, which you were like, oh, that's conservative management of acne. And I'm like, yeah, but it's the front line. And then I do find that a lot of people... Well, it's just, if you could just use a really good skincare regimen every day and not need Accutane, then yeah. But I mean, I think Accutane's an important treatment for when it doesn't respond. But it's just most of the time you can clear up your skin with skincare. And I have to say that I've even had patients who've had Accutane treatments in the past, even 2 or even 3 full courses of Accutane, and they still had some acne, and they were able to clear that up with skincare. So,
I'm with you, Dr. D. I'm with you. I believe Accutane gets a bad rap. So you find me playing devil's advocate depending on who I'm talking to. So if someone comes in and they're like, oh, Accutane is it, this, that, and the other, I go on the other side saying, hey, have you tried this and the other? But if someone comes in, because I get a lot of patients who come in who are really, really scared about Accutane, so I have to put them at ease.
Yeah.
I think it's a place for everything, right? It's not one versus the other as much as I think what you and I are saying is, hey, why haven't you tried the basic skincare guidelines, like having a clean face, reducing the bacteria on the face, reducing the level of oil, a toner, all those things. Why haven't you done that? And you're talking about acne. And that we can agree. Sometimes that's what's given. I believe what's happening is there's an assumption being made, right? If you come to a dermatologist's office and, we have like 5 minutes because we have 40 patients to see, there's sometimes an assumption being made that you have tried all the other basic care plans. And that's not always correct. You know what they say, what happens when you make an assumption, you make a, you know what? So I think that may happen many times where, yes, this person hasn't any skincare, but think about it. The doctor is thinking, you're here to see the doctor, and it works both ways. I have to give you a prescription. It happens if they come to see you and you don't give them prescription, they're also upset. So
Right.
I think our discussion today should be really, okay, let's go over what you should be doing, what you believe they should be doing as basic skincare, and then what are the advanced, let's call them advanced therapies, which are prescription,
Exactly.
and all those things, which,
And
yeah,
and kind of like you were saying with hair loss treatment, that even after you've had a transplant even, it's important to continue to take care of your scalp and your hair and nourish your hair growth. And so even if you've had Accutane, you still have to actually take care of your skin with good skincare. So, I mean, at least for me, there are 3 basic components to that I recommend for people. So first is an exfoliating cleanser that actually helps exfoliate all the dead cells from the surface of your skin, because in every pore, so like, I mean, I'm not teaching you, of course, I'm telling our audience,
me.
right? So in what the acne forms is every pore, okay, has those same cells on the surface of your skin. Those are inside the pore, and those need to slough out of there. And what happens is the turnover of your skin gets slower as you get older. And so those cells get stuck, and they get stuck enough to the point where they form a little plug. And then the plug blocks oxygen to the pore. It's now sealed off, and bacteria starts to grow in there. And then the bacteria has to grow like big enough to notice, and then big enough to erupt, and then resolve. And that whole thing is like an 8-week cycle. And so the keys to preventing the acne is all the things you mentioned earlier, briefly. So getting your skin clean, using an exfoliating cleanser, or another kind of exfoliant that like gets your dead cells to slough out of that pore, a toner that further cleans out the pore and kills bacteria. Anything that kills bacteria, like a topical antibiotic, will be helpful too, or benzoyl peroxide. And then something with a tretinoin or retinol of some kind, where those are great for your skin and for a lot of reasons. But the big thing for acne is that it increases the turnover of your epidermis. So those cells slough faster and don't get stuck inside that pore. So those are the basics that I recommend. The other big thing that I don't think that people really understand is that so many skincare products have acne-causing ingredients in them. Sure. So I actually have this handout that has this giant list of ingredients that are really common in over-the-counter skincare. And if you do have, a product at home that you just love, that you can look at that ingredient list and make sure it's not chock full of these ingredients that are acne-causing. Because most of the time what I tell people is, okay, whatever you're putting on your skin, let's put it in a drawer and just save that for later. And use these use these 3 things, right? So the cleanser, the toner, and then a retin-A or a retinol. And then, if they need things like a moisturizer or a sunblock and things like that, we have things that do not trigger acne in the vast majority of people that we recommend. But that's kind of my recipe.
I love it. I mean, that's basically, we're in the same line. I'll go over my spiel. I try to, for my patients, I always try to educate, right? Because half the battle is if you're going to get someone to be compliant with what you're giving them, many people want to understand why am I doing this particular process? And not to say that they will all do it, but at least it gives them a better chance of understanding why the step 1, step 2, step 3. And I love your exfoliating cleanser, your toner. Usually those are not things I emphasize my first visit. I always emphasize that with acne, we're dealing with 3 things. We're dealing with bacteria, we're dealing with oil production, and we're dealing with hormones. So my intro to my patient is really to say, hey, you know what? These are the 3 things that any acne prescription should somehow tackle those 3 things, right? The bacteria, you get bacterial overgrowth because it's feeding on this oil, this newfound riches as usually for teenagers or adult acne or hormone-triggered acne. The oil glands are producing a lot more. There's hypertrophy of the oil glands, and there's a lot of oil, which I believe triggers a lot more generation or should I say division of the bacteria on the skin. And then your body sees this action and there's huge inflammation within the pores, and then you have your acne. So I try and basically make it very simple for my patient. And I say, hey, what I'm going to give you is going to deal with bacteria, it's going to deal with the oil, and in some cases, deal with the hormone. So when it comes to bacteria, my first line is clindamycin and benzoyl peroxide. I usually do a combo because it's been shown, studies have shown if there's any resistance to any of the topical antibiotics, if they're resistant to benzoyl peroxide, usually the clindamycin will treat them. So combo of those 2. And then, of course, the retinoid. I usually try not to get into the battle of the retinoids. Oh, am I going to use adapalene? Am I going to use tazarotene? Am I going to use different, which is adapalene over the counter? I tell them, hey, look, just as we're using an antibiotic being the umbrella term, we're using these 2. I could have used any antibiotics. I choose to use tretinoin. I like tretinoin. So I do tretinoin 0.05 and I increase it if necessary. The tretinoin, I tell them, is going to target. It does a lot of other things, but my patients don't want me to go into the physiology of it. I just say, hey, it's going to help reduce the oil production, and it's going to cause, as you said earlier, a rapid cell turnover, which will make your face basically slough off the dead skin, look and be glowing. It's anti-aging, so that's that benefit over there, not to mention of the acne control benefit of it. So tretinoin, or should I say a retinoid. The next thing I tackle is, do I want to give them an oral antibiotic or not? Depending on if it is inflammatory acne, those are the individuals who have these really red comedones with pustules. I might ask if at this particular visit I don't see them, do you get these? That kind of skews me towards if I'm going to give them a short course of an oral antibiotic. The most common go-to for most dermatologists is doxycycline. It can cause some GI upset. So I give you doxycycline and I tell my patients, I don't intend to have you on this oral antibiotic for more than 3 months. This just gives you kind of a jump start on the bacterial control while your benzoyl peroxide and clindamycin topical and your tretinoin gets into action. I give them the analogy. I say, think of your face as a garden. Right now, your garden is growing a bunch of weeds that we don't want. We want to cultivate this garden so that it only produces what it's supposed to produce. And introducing these topicals are going to kind of change the milieu of your face. And gradually, your face is going to begin to do what it's supposed to do. I usually use the phrase, it's not a sprint. It's a marathon. It's going to take some time. I give them a timeline. I say, hey, it's going to take about, let's not judge this regimen till 12 weeks in. I do not see them to 12 weeks. I actually bring them back in 2 weeks or 4 weeks, depending on timing. Why do I do that? I do that because there are a lot of patients who are so gung-ho about treating their acne that they don't hear stuff like when you say, hey, your tretinoin is going to make your face dry. So they go home, yay, I got my acne regimen. They start treating themselves and they get the dryness. They didn't listen or they didn't hear the fact that you said they're going to need a lotion with sunscreen in it or something to augment it. They stop using your tretinoin. They stop using your retinoid, which is one of the major components of what you're trying to do, because they hated the fact that they're being dry. Well,
Right. I have to say what I typically do with that, because I also have a acne triple gel that has those three things in it. So the Clinda, the benzoyl peroxide, and the tretinoin. But
awesome.
I like to start people on a point 0.025.
Okay, so you go a little lower.
And I start that every third night, slowly work your way up to every night. And then once we kind of go through that 1 ounce little jar, then we'll switch to a 0.05 and go slowly again, because what happens is, if they run into that, red, flaky, irritated from too quickly, right? If you introduce a tretinoin too quickly, they think they have like an allergy. They'll a lot of time people will say, "Oh no, I'm allergic to Retin-A," and it's really because they started too high a concentration too quickly, right? So if you go really slowly, then you won't get those, because the increased turnover. So the cells that are making your brand new keratinocytes, they kind of speed up as the sloughing happens, and so if you go slowly enough, they just don't have that irritation. If you go to a 0.05 every night on someone who's never had a Retin-A, their face will be like on fire in 3 days.
Yeah, so what I do is I tell them to do the 0.5. I usually don't go that low as 0.25. I think your method is perfect for a slow progression. I usually go right into 0.5, but I say for the first 2 weeks, do it every other night. So you do it every third night. I say do it every other night. What I try to counter that situation you just described about the redness, I try and counter it with the education. So the extra time I spend talking to them about what to expect helps them realize whether they need to do it less, and also the amount. So some of these individuals are so hyper about getting rid of their acne, they put too much on.
A lot. Yeah, I've
I'm like, hey,
tell them 1p.
yeah. So they go gangbusters. I'm like, look, I can, and I tell them in the education, look, I expect exfoliation. You're going to get peeling. I don't want redness. If you get redness, you are using it too often, taper it down. But I totally approve of that 0.025 and a gradual uptake. I'm trying to be fine in the middle. My patients anybody who has acne is a little impatient. They want it. And I'm like, okay, we're going to try and get you as much change as quickly, but as safely as possible. Right. So your method is good. I like that. If they're going to be patient with it.
The other thing you're saying, you would put people on oral antibiotics to kickstart everything and try to help clear them up. The other thing that we will offer at that time, like if they're acutely broken out when they start, is either a VI peel, the one that's made for acne, or a series of those if they really need that. But that has been amazingly helpful to get people kickstarted out of this cycle of having the terrible outbreak.
Tell me a little bit about the VI peel. I haven't really used one of those.
Yeah, I've had that it's an kind of medical grade peel. They have a few different versions of it. One regular one for melasma, one for acne. And it is a really pretty amazing peel. Like you peel a lot, you kind of molt. And so for people who are real serious pickers, it's not the best idea. But for most people, you put it on, and about 2 days later, 2.5 days later, your face sort of cracks open and it comes off in sheets. And it has just a lot of ingredients that kind of penetrate into your dermis and that help prevent another outbreak. So
is there any concern for skin of color for BIP?
No, so it's totally safe on any skin type. So that's one of the reasons I have it in my office. I'm sure we talked about this last week, probably. I just feel like anything I offer, I have to be able to offer it to everybody. So yeah, it's amazing. So yeah, actually I don't usually mention brands on the podcast, but like that's the one peel that I feel like I'm pretty loyal to.
Well, if it works, it works. I mean, you got to give them their due.
Yeah.
I wanted to answer questions about what happens when what we just talked about, which I described as conservative management, does not work, right? When you encounter those recalcitrant patients who you have done your They're doing everything right at home. Right? They're doing the exfoliative cleanser, they're doing the toners, they're doing the topical antibiotics, they're doing the tretinoin. They've taken the 3 months of oral antibiotic. They come back to your office. They swear by it up and down. They did everything, and they still have acne, and it's scarring acne. Right? What are my options there? I give them both options. I say, hey, look, we can tweak the treatment type underneath each banner. We can say, hey, for the topical antibiotic, maybe we don't use benzoyl peroxide or clindamycin. Maybe we start using something called dapsone, maybe we try dapsone. And under the tretinoin, maybe we do something like tazarotene, which goes after other receptors, of other retinoid receptors other than just tretinoin. Or maybe we do under the oral antibiotic, we do something stronger like Bactrim. But I tell them that this is still doing the same regimen, just different kinds of those drugs, those medications.
Mm-hmm.
The other thing would be there's a new medication on the market called Winlevi, which targets the sebaceous glands and the hormones released from there. So I say, hey, we could add that twice a day. It's complementary. It's not one or the other when it comes to a tretinoin. So you could still stay on your retinoid and do Winlevi. The Winlevi claim to fame is that it targets more hormones than the oils of the bacteria. So I could throw that on top of everything. I also explore, is there a place for spironolactone if I'm talking to a lady who, it might be the cycle, related to our cycle. So I say, hey, maybe we'll add to your regimen spironolactone. That you can start at 25 milligrams. You can go all the way up to 150 milligrams. I usually go slow and check every 2 months, every other month to see, every 2 months, every month to see if there's a difference that time of the month with what happens to the acne while they're on the medication. So I do that. And then I always at the beginning, first consultation, I talk to them about Accutane. I talk to them about isotretinoin, risks, side effects, benefits, right? My stat is I say about 8 out of 10 patients, 80%, will never have to see me again for acne if they get through an entire route of Accutane. But I also am very transparent that 20% might actually have acne come back, but usually it's never as bad as the recalcitrant acne we started with.
Yeah, and I definitely have seen that as well. So I don't do Accutane in my office, but I've definitely seen people who have it still after Accutane, but it's not as bad. I have to ask you, so because I've seen this, it's not super common, but I see at least a couple cases a year of people who, those recalcitrant cases where it's the deep cystic acne, that like those deep ones that don't even go anywhere and don't seem to respond to anything. Occasionally I have somebody, it's really from weirdly a cow milk allergy.
Interesting.
Have you?
So just to be clear, are you describing those deep cystic acne usually around the chin and jawline area?
Mm-hmm. And they can kind of be anywhere. I've had a number of patients where this started with one patient who knew about this, right? And this person was like, oh yeah, I can't do any cow milk of any kind. And that's anything with whey or casein in it, like protein powders and granola bars and stuff like that. Not just like the cream in your coffee, but every once in a while I'll have somebody with those, hey, I've done absolutely everything and nothing's ever worked. And when I mention it, well, there's this rare cow milk thing that I've seen. Every once in a while someone will be like, oh, I think that's probably me, because I have noticed that every time I eat dairy, I have a terrible breakout. So I do try to avoid it, but I just can't give it up. And and I have definitely had a few patients where if they just eliminate cow milk, and if for some reason it's not goat or sheep, and it's it's so they can have goat yogurt, and they can
we put a lot of things in our cows these days.
Right.
So
Yeah.
is it really the cow milk or the stuff that we put in the cow?
Or the weird things. I don't know.
Yeah, I don't want to digress into forks over knives. Yeah. Yeah. Studies have shown that skim has a direct relation to some inflammatory acne. Skim milk. Cow milk, I'm going to put that in my mental dossier for treating my patients. dairy and inflammation can kind of go hand in hand. I mean, I don't think that's a mystery, but if you have an allergy to cow milk, I won't be surprised if you get some skin reactions to it. I haven't encountered it, and it may not. It's not that it hasn't encountered me. I had a professor of mine, Dr. Eve Lowenstein. She used to say something that stuck with me. She said, "Study hard." You know, she was one of our mentors in residency. She said, "Study hard and know as much as possible, because the fact that you don't see a condition doesn't mean that the condition doesn't see you." And she meant,
Right.
just because you don't know about it, you're not going to find it if you don't know about it. So now that you've told me this, I'm going to be on the lookout for acne that's recalcitrant, and probably throw that in there. I mean, a time away from dairy is not harmful for adults, right?
Right.
So throwing that into a situation and saying, "Hey, why don't you cut this out for a month and see what happens?" I have no problem with doing it. But that's basically my, nuts and bolts. Combined with what she said, I can't disagree. I mean, the VI peel or a chemical peel, exfoliating cleansers, toner, topical antibiotics, oral antibiotics, tretinoin, or should I say a retinoid,
Mm-hmm.
along with other skin regimen like a nice vitamin C serum, HA, hyaluronic acid. Having a good skincare regimen should be the baseline for when you have no problems. When you have the acne, you want to treat the acne, and then all these things that classify into treating the acne. Even when the acne is gone, you need great skincare regimen. So I bring my Accutane patients or my isotretinoin patients back after 2 or 3 months, after the washout period, and I put them on. They're still going to be on a topical retinoid, even though their face is completely clean, right?
Mm-hmm.
I recommend a topical retinoid for all my patients in their skincare routine. I tell them, I say, you don't have acne, but it's anti-aging.
Exactly.
Why wouldn't I recommend that for my patient who are just, is doing better on their acne? So it's just,
Plus, you can develop acne any age.
Yeah.
I see people who, as your turnover slows down, if you're not on a tretinoin or a retinol, that acne comes back eventually because the turnover slowed down long enough for those plugs to start forming again. So I think it's, number one anti-aging ingredient and anti-acne ingredient.
It's a retinoid.
Yeah, exactly.
Yeah.
I will say I have seen some people develop acne with certain vitamin C's. I've seen that happen.
Oh, really?
Mm-hmm. And
Do you think it's the vitamin C, or do you think it's the vehicle?
It's so impossible to know. I have seen it more with vitamin C than other serums. So like what I usually do is get them on that basic acne regimen, and then each new thing we add, we only add one thing at a time. So if they do develop, for some reason, a lot of these serums, sometimes people will get whiteheads from them. Mm-hmm. And so you add it one thing at a time, then you know that that's the thing that's causing it. Otherwise, it's really hard to tell.
I agree. I mean, I like the idea what you said earlier is put everything in your case for now and just do what I say. I do that a lot with my patients.
I don't tell them to throw it out because that's too upsetting for them. I just put it in a drawer. And then, what happens over time is if their skin clears up and they're really happy, they're scared to even touch those things, and they just throw them out eventually.
I had a patient of mine just the other day, in fact, yesterday, who for 2 years, he was so red in the central face that we were working out for lupus. For 2 years, she had been dealing with it. And you know what it turned out to be, Dr. D?
What?
Powdered makeup she was using. Makeup powder.
Yeah.
And so she had been on topical steroids. She had been on fungal. We gave her oral antifungals. And finally, I did a biopsy. And while I did the biopsy, I said, "Hey, we're going to stop everything. We're just going to do a topical steroid because I see that you're inflamed. Come back in 2 weeks and see what the biopsy." Before she came back, she was completely clear. But by the time she came back to see me, she had some redness. I didn't know she was completely clear, but she looked 80% better. So I said, "Hey, you know what? We're going to do a steroid again. You go in the right direction." She said, "Hey, doc, I've been clear before. I had an event with my son and I put this powder on." I'm like, "Oh, ding, 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 ding." A powder. Yeah. There's something in there you're allergic to. So you're right.
So yeah, I have to say, of all the things people put on their faces, the things that are causing the acne more than anything, the top two are makeup, like certain makeups. I'm not going to name bad brands, but there are a lot of them. And then also sunblock. A lot of over-the-counter sunblock is awful for acne. And so those are the top two things that the first thing you want to put in the drawer are those things.
Seek out non-hormonogenic. Make sure they have that written somewhere. And
but even that doesn't have that doesn't necessarily, I mean, we know what that means. It doesn't cause acne, but there's nothing that you have to prove in order to put out that on your label. So just because it says non-comedogenic doesn't necessarily mean that it is.
Yeah. And that's a good place to start. But other than that, you're right. It's still individualistic. I've had patients, my triple gel has lavender in it. So it's wonderful for everybody except if you have a lavender allergy.
Yeah.
So it's like, you don't know until you know what exactly you're putting on your face. And manufacturers don't owe you anything to tell you when they change. Because I have patients who come in, I've been using Pond's, I've been using Olay my entire life. And I'm like, did they send you a mail that they changed one thing in their prescription? Oh, no. So I'm like, you never know. You could still be allergic to something in that particular mixture.
Exactly. So there's just a couple other things that I do tell patients with acne. So one is if you are a picker, which almost everyone who has acne tends to be, but if you're a picker and you just can't help yourself, okay, what I typically say is, look, make either an acne facial appointment or a hydrofacial, which we have like one that's made for acne with an acne booster, but that will extract all of those blemishes for you professionally in a safe way. So you don't do it at home because, nobody wants all the, blackheads and whiteheads on their face. It's yucky. Nobody wants that. So, but if okay, on Thursday, I'm going to go get this cleared up, then I won't touch my face. If you can hold on till that appointment, I think that's super helpful, especially for people who because when you do pick and you squish a blemish, right? Now you pick another one. Now you're spreading that bacteria all over your face.
Not to mention the post-inflammatory hyperpigmentation that results in the inflammation you're going to cause.
Yeah.
Tell me a little bit, Doctor. I don't have a hydrofacial in my establishment, and it's something I've been eyeing. Does it take care of milia or just open?
No, for milia, you have to either use Lancet or we have a Thermalo, like a low-level cautery that can zap milia. No, but it's basically like a wet vac for your face. And I didn't used to have it. I'm like, oh, it's just a machine that's expensive that takes, it puts a machine in between the hands of the esthetician and the person. And like, so much of what's kind of luxurious and feels good about a facial, like you don't get that. But for me, I finally caved and, demoed this machine, and I have pretty clean skin, but basically it's a device that exfoliates and infuses fluid of various kinds into the skin and sucks it out. And it just cleans every pore. It's kind of amazing. And then it's got this jar that it collects everything in. And I don't know if the official name is a gunk jar, but we call it a gunk jar. And basically at the end of it, you look and see all the gradu that used to be in your skin. Wow. And so it basically cleans out your pores. It's just, there are a lot of different devices that do a similar thing, or even just a regular old acne facial where they do extractions, like they'll cleanse your skin, you'll get a peel,
How often do you recommend the hydrofacial? Is that a monthly thing or by 2 months, every 2 months?
Monthly, or however often you feel like, oh gosh, my skin's getting congested. I just want to get rid of these things now. So for people who know that it's very difficult for them to not touch their face, I find that just pre-scheduling it so that you can look forward to that, it's really, really helpful to, prevent recurrence and prevent spreading the bacteria all over your face and prevent that hyperpigmentation you were talking about.
I think, Dr. D, we just cured acne all across America.
Well, I think that's a lot of really good advice. Hopefully this has been helpful for people. I have one last question for you before I let you go. I know you've got a busy afternoon. Do you ever perform or recommend acne steroid injections?
Well, I have done acne steroid injection. I'm not a big And I'll tell
Yeah,
you why. Do they work? Yes, right? It's catalog, it's going straight into an area of inflammation. We know that steroids work in an area of inflammation. What I don't like when it comes to the face is catalog's side effect can be atrophy, right?
yeah,
So you could end up giving the person a dimple in that area of skin
exactly.
that may or may not recover. So that is my only reservation. Low doses can be put in, but you still have to lead with the caveat that this may leave you with some atrophy. So I don't want to poo-poo it and say, hey, no one should do it. I'm just saying that go in knowing, unless there's some emergency, I got a wedding, I got a picture I got to take tomorrow, know the risks. And I still can do it if someone comes in and says, hey, doc, my wedding is tomorrow. My wedding is 2 days from now. I can't have this giant zit on my forehead.
Yeah, and we've had a handful of requests over the years like that, or somebody's about to be on television, or something where it's like an acne emergency. But
Yeah.
I always warn them, yeah, I mean, this could leave a little divot in your face, and that could be a permanent scar. So it is also like absolutely not my favorite thing to do, but every once in a while I'll get talked into doing one.
I have friends, and who have done a little care package for those who get sudden flares right around the wedding. They do a prednisone taper, like a 20 or 20 to 40 milligrams of prednisone taken for 3 days. That kind of gives that kind of arrest the flare right before a major event. So they've also done that oral. Yeah, what is there like little tricks in the bag that you have for those rare occasions, but not something you do all the time?
Yeah, I would say for anybody listening, if you know you do have a wedding or a big event, plan way ahead and get rid of the acne before it's last minute. Um, well, hey, Dr. Rex, thank you so much for being on the podcast today. It's always fantastic to talk with you.
Same here, Dr. D. I appreciate the time.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website MedSpaMayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate Dee. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.